Hi everyone, and welcome to the newest episode of Prende Talks, our series of conversations on some of the most overlooked and yet the most important topics affecting people with bacterial vaginosis and yeast infections that are recurrent. Today we'll be talking to Rachel Wright. She is a certified psychotherapist focusing on sexual health and also relationships. She's the host of her podcast, The Right Conversations, where she discusses some of the most important topics affecting sexuality, and also has a really big presence on social media, providing educational content to people who have questions about their relationships. So we'll dive in today to talk to her about how BV and yeast infections affects people's intimate relationships. We're super excited to have you today, and maybe we could just kick it off. Tell us a little bit about yourself, about your journey into this career.
Oh man, I have been interested in people, behavior, and sex since I was like 5. Truly, I always wanted to know why people did things. I always wanted to understand why certain people were drawn to other people or why certain people behaved differently than others. And I was like 7 or 8 years old when I snuck into my parents' room where they kept their books, and I read The Joy of Sex. And by read, I mean I looked at the photos and like ran out and like giggled and, was like, I don't want to get in trouble. And so I was just a very curious kid. And that translated into a career in psychology and then specifically around sex and relationships.
Got it. That is such an awesome story. I love when something starts, so early in someone's lifetime and really just stems from a true nature of curiosity. Maybe you can tell us a little bit about that relationship between mental health and sex, because I think they're so intertwined and yet very few people understand that connection point.
Absolutely. So I like to say I work at the intersection of mental health, sex, and relationships. Mm-hmm. And these three things impact each other, right? Our mental health impacts our sex life, our sexuality, and our relationships. Mm-hmm. Our relationships impact our mental health and our sex life. All the way around, right? Yeah. You cannot have one not affect the other two. And yet these three areas we are taught basically nothing about, right? We may hear like a couple sexual health facts, or communication is important in relationships, or, self-care is important for your mental health, like these generic kind of statements, but we don't actually learn what goes into our mental health, how we can take care of ourselves, what goes into our sexual health. Our sexuality, when we hear the word sexuality, most people think sexual orientation. Mm-hmm. And really, there are 14 different facets that make up someone's sexuality. Okay, and sexual orientation is one. Mm-hmm. So it's very complex. And it's a wonderful topic that I love teaching on because it impacts all of us, right? Whether you're asexual or allosexual, you still have a sex life. You still have a relationship to sex. Mm-hmm. And whether you have a mental illness or not, you still have a relationship to mental health. And we all have relationships, whether that's with ourselves, romantically, sexually, family, platonic. Mm-hmm. We all are in these things.
Yeah. And, it's something that we talk about a lot at Prende because we focus on chronic vaginal infections. So bacterial vaginosis, yeast infections, there's even more different types of vaginal infections just beyond that. But there's a really big self-confidence component to that, which is the physicality of having an infection creates the way that you feel about yourself, impacts your overall mental health, impacts whether or not you want to have sex with your partner, how you feel when you have sex with your partner. And so there's, so many different facets at play, but maybe we can start off with what you've learned about shame and sex. Because for someone, even my personal story, like coming from years of vaginal infections, back-to-back yeast infections, it's like you're worried about going to have sex or meeting somebody, and what do you say to them if something goes wrong? And just a very much a culture of shame.
Oh, 100%. Shame and anxiety and fear, and that's because we're taught what not to do, not what to do, right? In every sex ed class, even if it's the best around, you learn how to not get pregnant. You learn how to not get an STI. You don't learn how to have a healthy sex life, what pleasure looks like, how to communicate about things like yeast infections. And, we were talking before, sexual health topics like yeast infections and BV don't even get covered in most sex ed. And so then there's this additional shame on top of our societal shame around sex that's just embedded in all of us, right? As kids, when our parents are covering our eyes when there's a sex scene in a movie, that's not protecting a child, it usually is saying shame, right? Like, we're uncomfortable as adults letting our child watch these two people make out on screen. Yeah. So we're going to cover their eyes so we're not uncomfortable. It's not bad for a 9-year-old to watch people make out on TV, right? There's nothing wrong with that. So shame pops up. We need to know how to communicate. And that's hard too, because we don't get taught that either. Yeah. So then we're talking about something we don't know anything about, and we don't have the communication skills.
Yeah, and not even just in relationships. I remember my first yeast infection. I was a senior in high school. I'm like generally healthy, athletic person. I'm ambitious, like to push myself. And then all of a sudden I had to go up to my mom with like probably the least confidence I've ever had approaching my parent and say, so I think that something's wrong. Because you're young, you don't have a general OBGYN. What doctor do you go to? Right. Let alone if I was in a relationship, like it has such a big impact. You have to tell people so that you're, changing the way that your daily life operates. Yes. So communication's key.
So key. And it's so challenging because the messaging that media sends and consumerism sends around vaginal health is that your vagina and vulva are supposed to smell like a rose or like baby powder. And like, no, it's supposed to smell like a vulva and a vagina. And because we don't understand that fundamental, when something shifts and something is off, when there is a foul smell, when there is discharge that's not quote unquote normal, we don't know. Because the baseline that we've been taught is like, smell like a flower. Yeah. And that's not good. And in an effort to smell like that flower, you're going to mess up the pH, as you know very well.
I want to come back to that point because there's actually something very key that I think we could teach our viewers and the women that interact on Prende. But I'll just speak really quickly to the fact that like within our clinical team, like we try to create a culture around these certain products will display a brand that makes you think that you have to smell this way or makes you think that this is a normal amount of discharge. Yeah. And there's a lot of like, myth busting around. So you're actually like, this part is okay. What is not good is this part when you experience this type of infection, when you feel this way. So once again, just creating the shame and the worry, the needless worry around normal things. Yes. But I really want to focus in on, you said like, okay, like I smell today or I have a lot of discharge today. Can you talk us through how to have a conversation about that with a partner so that when you go in and, there will be intimacy involved, you want to have sex with this partner, and then all of a sudden you're worried and you feel like you need to tell them about this is the symptom I have today, right? I might be worried that I smell today.
Absolutely. So if you have gone into the doctor and you know that you don't have an STI, you know that you're generally healthy, but something is just a little off today, which is normal, right? Our hormones fluctuate, stress, all of these other factors changes everything. So there could be nothing wrong, and you could still smell differently than some other day or have a different discharge. And so having the dialogue with your partner and just saying, hey, I'm super excited to be with you this evening or this afternoon, whatever you prefer. This morning I noticed that I smell a little different and I am feeling a little embarrassed or I'm feeling a little anxiety, whatever the case may be. And I wanted to name that in case you noticed it too. And it's not an STI. I've been checked for all of that. But I wanted to just get it out in the open. Yeah. And often your partner, if you've been with them for a bit, they'll also notice if something is so different. And sometimes they'll be like, what are you talking about? There's nothing different. And you're like, yes, it is. And they're like, no, like it's the same. But we're in our own body so much that like the smallest shift we notice and we're like, oh my gosh, this is uncomfortable. So often it's not as big of a deal as we think. But naming it out loud and saying, I'm feeling nervous because I got waxed yesterday and the baby powder that they used made me smell different than I typically do. And I'm feeling nervous about that. And naming these things before you're in a sexual container is really, really, really helpful.
Yeah, because once you're in it, the process of a stopping or, you're trying to engage with something that's, pleasureful and enjoying that. And then all of a sudden you're like concerned about what someone's facial expression means, whether it's like something good or if it's something bad or like they can smell something. So I guess like for me, for other people that have had these vaginal infections, I think that that's a really common experience, is to be in the midst of sexual activity, being with a partner, and then all of a sudden decide, yeah, I think I pushed it too far. I actually don't think I'm ready today. What does that process look like of, I guess asking for your own space or like for a pause when,
Totally.
Things have already gotten started?
So my general rule of thumb is to talk about a safe word before you enter into any sexual activity with anyone. And we usually only talk about safe words when we're talking about BDSM or like harder play or setting up a scene or kink. It's very specific, but it's very helpful with general sex, like anything. And when I say sex, I mean any meaningful experience of pleasure, just anything that you're experiencing pleasure with. It doesn't have to be penetration. Let your partner know, hey, I want to come up with a word that if one of us says it, everything just pauses. And if you want to give context, if you want to share with your partner, I'm battling recurrent yeast infections and I'm on and off this medication, I'm doing this treatment, I'm using that, whatever the case may be. And so occasionally I'll push myself too far and it'll hurt. And I want a way to pause without you thinking that you're doing anything wrong.
Yes.
And you pick a word, it can be pineapple or elephant or dresser, something totally random.
Yeah.
And then you could just say that and you don't have to think, oh my God, how do I tell them that please stop? And then they're like, did I do something wrong? Just elephant.
Yeah. Or that they might think that like stop is related to something else and then keep going. And then you have to do it again. And that's even more uncomfortable than what it was before.
Exactly.
I think that our goal is just to create a space where people with recurrent infections can actually advocate for themselves before, during, after, because there's actually been some studies on this where about 68% of people with recurrent vaginal infections experience really severe negative impacts on intimacy.
Yep.
And yet, to date, I'm pretty sure this is the first conversation that's been recorded about it and is going to be out so that, people can engage with it. Because so often we have somebody come to Prende and they get on a coaching call with Kim, our nurse practitioner, and they're like, so, I guess I might bring this up too. I don't know how to tell my partner about this. And so this is a repeat conversation over and over again.
One other tip that I will give for this conversation is ask for a container to talk about this. If your partner is unloading the dishwasher or folding laundry and you come up to them and just like, hey, by the way, I have yeast infections and like they're going to respond in a way that is a little whiplashy. And we, as the sharer feeling vulnerable, can feel judged or shame when really their reaction is like, I was just thinking about socks and now you're talking about your vagina. And like they don't, right? It's too fast. So if you approach them with, hey, I wanted to talk to you about something sexual, something sexual health related, however you want to phrase it, when would be a good time to do that? That way, both of you are entering into the conversation knowing, okay, we're going to talk about sex right now. And your partner can be present with you, they can listen to you, and you can share whatever you want to, how much or how little you want. If you trust your partner and feel safe, I say the more information, the better. Right? And let them know if you have questions, let me know. We can look it up together.
Exactly.
I want to share this with you because I'm sharing myself with you. And this is part of me right now.
Yeah. And that's one of the things that I've thought about a lot is that where are the good resources for somebody who is a partner who, it's so sad, but I don't think that people really understand the true impact of something as common as a yeast infection or as bacterial vaginosis until you've experienced it. So we have the entire population that doesn't have a vagina, plus other people that do have a vagina that haven't experienced these infections before. And you're kind of starting with square one. Like, how do you empathize with a searing, itching pain in one of the most vulnerable parts of your body?
Right.
It's not only physically painful, but now you can't focus. Now, like, having a conversation, your eyes drift and you're just thinking about, like, don't worry about this feeling.
Don't scratch it. Don't scratch it.
So it's really important to understand also that if you come at it like, okay, I know that the person I'm talking to is at square one because I don't know that they've ever experienced this before. So it is a two-way street where we want to be empathetic on both sides. Not only is someone going to be empathetic of me, but I also need to understand that, like, I'm doing a job I shouldn't have to do, but I do have to do of teaching somebody about a very basic and common sexual health problem.
And if those of us with vaginas didn't get the education, certainly someone without a vagina why would they know? Like we've had to either experience the infection or learn from a friend or learn from a sex educator later in life, right? So like we can't expect other people to know these things. I wish they did. I wish that was the expectation. Maybe one day we'll get there, but it's the same thing when I hear people joke about like, oh, that person can't find the clitoris. Well, yeah, it's because we weren't taught where it is. Yeah. Like no one teaches anatomy for pleasure. So they don't know, not because they don't want to know. They don't know because they weren't taught it. Yeah. And at some point they have to seek that information themselves.
Yep. And for most people, I mean, there's 18 million women in the United States with chronic yeast infections and BV, not even just like, one off. That's going to be most women and anybody with a vagina at some point in their life. So yeah, people will run into it in some way or another. And I think that people are often concerned about bearing the burden of what this actually is because it's so stigmatized in that way. And so another topic that I wanted to bring up with you, kind of veering off the tracks a little bit, goes into more self-pleasure or also with partners using sex toys. Yeah. There is a lot of misinformation, I think, around sex toys, and especially with recurrent vaginal infections, because people become concerned of adding extra bacteria to the environment, what an external thing is going to do to internal health and environment stuff. So maybe just start by kind of level setting with, when do people use sex toys? Why might you use them? What are the risks? What are the benefits? Because we can imagine that the benefits may outweigh the risk that have been portrayed to the world.
They do. Spoiler alert. Okay. They usually do. This is like, I have a literal workshop that is like 90 minutes just on sex toys. So we could talk about this for a very long time, but I'll do my best to summarize. Yes. So sex toys are supposed to do things that humans cannot do. Okay. They're supposed to enhance an experience and add to it, not be a replacement. And so a lot of the stigma around sex toys is I'm afraid that is going to replace me. No matter what gender you are or no matter what gender your partner or partners are, it is not a replacement. A sex toy may be able to vibrate or suction at a rate that our fingers and tongues cannot. It does not have emotions. So a sex toy is not going to replace a person, and a person is not going to replace a sex toy. Period. End of story. Now, once you understand that, you can think, okay, how do I want to integrate sex toys into my sex life? There's solo play, aka masturbation, and then there's bringing it into play with other people, whether that's your partner, partners, or whoever you're having sex with. No shame here. Yeah. So general rule of thumb, there are 3 materials that are safe and wonderful to use: glass, stainless steel, and silicone. Anything else, be wary. Okay. Now, if it says body safe on it, then it's safe for your body. But if it feels too good to be true, if you see something for $5 that is made from plastic, please don't get that. It's not good for your body. And unfortunately, there is no regulation on sex toys because they're considered toys and novelties and not actually a medical device, which is very unfortunate. It would be great if they were more regulated, but they're not. So if you stick to high-grade silicone, glass, and stainless steel, you're golden. And experiment. See what you like. There's body-safe plastic out there that is totally okay. It's just figuring out what works with your body. And the thing with all sex toys is that we need to keep them clean and we need to store them properly. So let's say you buy a toy, you take it out of the box, clean it, store it to where it's not touching anything else. If you buy a higher end sex toy, they usually come with their own storage bag. If it doesn't, grab a Ziploc bag. You don't have to reinvent the wheel. Just put it in its own container. And before you use it, even though you washed it, wash it again. Yep. Use the toy. And then when you're done, wash it, put it back. Then when you're ready to use it again, wash it and use it. So you're really bookending the washing on both sides. And to wash something, you can get a toy cleaner. I really, really, really suggest people get toy cleaners, because they are designed to not mess up your pH.
Got it.
Not all soaps.
Oh, yes.
Yeah.
It is. We spend a lot of time talking about pH at Prende. It's key and should be taken with every diagnosis of BV or yeast infection.
Yep.
And the goal is always to keep that at the right level.
Yes. And so unfortunately, there's a lot of like, in an effort to help people save money and not spend money on toy cleaners, people will say use unscented soap and hot water. Mm-hmm. That's true, but you have to make sure that that unscented soap is going to be okay for your pH. And that just takes an extra step, an extra level. And so I say just make it a little easier and get something that you know is okay. And with stainless steel and glass, you can boil the toys to sanitize them. So depending on if you're using it anally, if you're using it vaginally, if it's internal versus external, there's different levels of cleanliness that you're going to want to get. But yeah, that's the general rule of thumb.
Okay. Yeah, that's awesome, because one of the things that, you and I had brought up previously was it's also not just the introduction of things into the environment, but it's also, the potential for irritation on internal and also external skin and tissue that, is maybe still recovering from these micro tears that happen during yeast infection, or still feels irritated because you had a lot of discharge from that BV a week ago, or the medication that you use. Like, lots of medications are inserted vaginally. So if you want to use the toy vaginally, there's now a lot going on where your vagina just a couple weeks ago, it just, nothing was happening to it. So it can be quite a big shift in the environment.
The one other thing that I'll say about sex toys too is that lubricant is the number one sex toy. If you've never used a sex toy before, start with lube. Here's the thing about lubricants though, and I'm sure you know this. They are so not made equally. And there are some that literally have 5 ingredients in them that all mess up a vagina's pH.
In its own way.
Yes.
Yeah.
And then there are some that are so wonderfully made, so hydrating.
Yeah.
They like help balance pH. So
They do all the right things.
yes, there is a very large spectrum of lubricants, and just be careful, be aware. On my blog, on my website, I have a Lube 101 article that goes through kind of like the main ingredients to stay away from, what to look for. Because unfortunately, most of the things that are sold in drugstores or at grocery stores have these ingredients in them.
That's what I was going to ask, is I think that at least the vision around lube is it's like, oh, okay, I'm going to go in, I'm going to grab some real quick because I've never had this conversation with my partner. And today it feels a little dry. So I'm going to go get something just cheap and off the shelf.
Be careful. And luckily I know a couple of companies that have actually just moved into like your basic stores.
That's incredible.
Which so happy that that's happening. But if you think back to like when we were kids, those brands that were in the store then, usually not.
And you can kind of tell they might say something like warming pleasure for women, these kind of absurd taglines that you're like, oh, is that actually what I want as someone who identifies as a woman?
Anything warming, cooling, numbing, no. Just get it away. We need to just feel our sensations.
Yeah, and so as we think also about like lubricants and we think about products, I guess maybe could you speak a little bit to the process of talking to a partner about using something like lube, especially when it has to do with a medical issue? Because I think that the conversation around, oh, I feel like I want to try something, there's confidence in that. There's confidence in I'd like a sex toy, or there's confidence in I want lube. There's not as much in order to actually have pleasure, I need to use this. And if you say no, then I'm definitely not going to enjoy what's about to happen because I have like a medical need.
Yes. So if your partner is saying no to when you're saying this will help me enjoy myself, that's a whole other conversation. Right? Like, what is going on there? That being said, if you've never introduced lube before and you're concerned about bringing it up, you have to gain that same confidence about knowing that you're advocating for yourself. So saying, I will enjoy this so much more if we use this is very different than I want this. Yeah. And you can say both. You don't have to say your why, right? You don't have to say, I'm going to have micro tears if we don't use this product. And then it will lead to this. And then it will lead to that. you can simply say, I enjoy myself more when we use this. And vaginal dryness is something that happens all the time to vagina owners of all ages for a million different reasons. And using lube consistently is a wonderful, wonderful practice. So same thing, ask for the container to talk. Hey, I want to talk to you about something sexual. When is a good time? When you sit down, you can acknowledge if you have or haven't used it before. So, hey, I know we've never used lube before. I really want to use it because I saw this video and I heard that it can actually help with my pleasure. Would you be open to us using it the next time we have penetrative sex? Yeah. And that's it. Like, as simple as that. And if your partner is like, why? Ask them what is coming up for them, right? Like, put your curiosity cap on and ask them why they're feeling resistant to something that you're saying is going to help you.
And it makes sense because we might imagine that it means, oh, well, then I think I'm not actually performing as well as I thought. And it comes back to these, once again, ideas of confidence, not just on your side, but also on the side of the partner. So this has been a theme that's come up, this container to talk. And obviously you are a therapist, so you see people for these exact issues. Can you maybe talk to us a little bit about what it's like to work with someone and what are the common reasons that somebody or them and their partners come to you, and how you build up their strength and their relationship over time?
Absolutely. Anything that's going on in their sex life or anything that's going on in their relationship that they wish were different, that's when they come see me.
Okay.
And sometimes that manifests from a mental health issue. Sometimes it doesn't, and it's reverse, right? The relationship or sex thing then causes anxiety or can cause depression even, or can cause just emotional dysregulation and like feelings you don't really want to have and tools you want to learn. So I work with individuals, couples, triads, quads, family, like you name it, I've worked with them. And I help teach them tools so that they don't need me forever.
Okay.
And work with them to heal past traumas, release shame, gain some knowledge and skills that, like we were saying, really should be taught.
Yeah.
When we're little.
And I wonder, if you bring up past traumas, if any of the past traumas has ever been related to a medical issue. Like,
oh, yes.
The feeling of having sex with a yeast infection for so long brings up a trauma of, I don't really feel comfortable having sex anymore.
And it shuts down libido, right? And then all of a sudden you're like, well, I guess I just don't have a libido anymore.
Yep.
And it may be that your brain is protecting you from feeling vulnerable. And that is very common. And it's really important if your libido has shifted from what your normal is. There is no normal libido, like objective, but we all have our own normal and what we have come to see as our typical libido.
Right.
So if something shifts from that and you've noticed it's lower, it's much higher, ask yourself, is this something that I want to be different? Is this hurting my life? Is this impairing my life? And you can change it.
Yeah. And so when you say you can change it, is that often through a process of therapy of sorts, whether that's talking to you or talking to a partner, talking to yourself, asking yourself questions? Because so often we also don't do that.
All of the above. I always send them to a doctor first to get all medical things ruled out. So if somebody's having chronic BV, no amount of talking is going to help fix that, right? So send to a doctor first, rule out everything. Now, it could be an and, right? They may need treatment for chronic yeast infections or treatment for chronic BV. And because of that chronic issue, they are now having mental blocks around sex. And so then we need to undo and recreate new neural pathways there. And they'll be getting, medicine to help with the internal stuff.
Yep. We talk about that a lot, the creation of new patterns and new neural pathways, because for somebody who's been having infections for months, if not years, right? There's a process of, I think I feel an itch. It's time for me to go run to CVS, grab a monostat, because I'm going to nip it in the bud before it gets there. And then, as it turns out, 2 out of 3 women who self-diagnose are actually wrong. It's unfortunate. So you've used the monostat, you didn't need it, it introduces new things get worse. So there's a lot to create a new pathway around, and that, understanding that sometimes you might have symptoms, what is an effective way to handle them, and also around how they impact life with partners and intimacy and pleasure.
Yeah.
Life is about feeling good at the end of the day. We don't do all of these things to, be unhappy when we're with people that we'd like to be really happy with.
Absolutely. And give yourself some compassion, like we keep saying this, but we did not learn this stuff. Mm-hmm. And so give yourself compassion and space and grace to learn and to grow and to make new choices based on new information, and to know that you were doing your best with the information that you had. And that's all we can ever do.
Yeah, absolutely. Rachel, it's been such a pleasure to have you with us. I guess as we kind of wrap things up, what is your favorite piece of advice to give to people that come to you with a medical issue that's really at the core of why they're struggling with intimacy, sex, and relationships?
Oh man, just that you are enough and you're wonderful just as you are, and you can accept that while changing things. Mm-hmm. That is such an and that we struggle to do, right? Yeah. It's like, I accept myself for who I am today, and I want X, Y, or Z to be different. And we can't get that change unless we accept ourselves in the present.
Yeah. So often they are two separate things, but acknowledging them at one time opens the doors to just bringing you happiness.
Exactly.
Even in the midst of something that can be really physically
yes.
and emotionally uncomfortable.
Exactly.
Yeah. And I guess just to cap things off, where can our viewers learn more about you? Is there a place where they can keep up with what you're doing, listen to more content? I know you mentioned you had some really awesome workshops that people can engage with.
Absolutely. My website is rachelwrightnyc.com. Mm-hmm. There are workshops on there, blog posts, so many things to have fun. Yeah. My Instagram also has a lot of stuff. That's where I primarily hang out on social media. Okay. My handle is @the_right_Rachel.
Got it. All right. Well, thank you again for the conversation, and we'll be excited to keep up with you and also see how we can help so many people improve their sex life and their relationships, even in the midst of chronic yeast infections and BV.